Hello, everyone, and welcome to SBH Bronx Health Talk. This is produced by SBH Health System and broadcast from St. Barnabas Hospital live from the Boogie Down Bronx in the 33rd District, right in the middle of my district. My name is Gustavo Rivera. I represent, as I said, the 33rd Senate District here in the Northwest Bronx. I'm also the chair of the New York State Health Committee, a big fan of this institution, and I'm happy to be here with you folks. Now, COVID-19 has devastated communities across America, and in particular, communities of color and in New York City. In fact, this is some of the zip codes right in my district during the height of the pandemic were some of the ones that were worst hit. And when we look across the country, and certainly here, we see that the most impacted of all have been Latinos and Latinx. And these are terms which I will use interchangeably today. I usually go to Latino since I'm more of an old school. In other words, I am old, so stay off my lawn. But let's talk a little bit about the Bronx. The fact that demographics of the Bronx, they're characterized by Latino majority. And this is certainly not just in the Bronx, but certainly in my district as well. But the fact that we are a majority in this borough is actually unique to all the boroughs of the city of New York. We are the only one of the five boroughs, of five counties that have a Latino majority. As of 2017, Dominicans make up 22.4% of the Bronx population, and Puerto Ricans made up about 19.6%. I should tell you, although I was born and raised in Puerto Rico, I represent more Dominicans than any other state legislator in the country, because as they've gotten priced out of Washington Heights and such, they've moved across the bridges. So there's a lot of folks that live over here, and most of them live in my district. And the entire United States, the Bronx has some of the highest concentration of both of these Latino groups. And this is not to mention Mexicans that are also very well represented, as well folks from Latin America, from Central America, the Garifuna community, et cetera. So it is a wide variety of Latinos that live here in the state of New York, but particularly here in the Bronx in very, very high concentration. But there's also a reality that even prior to the pandemic, Latinos faced extreme challenges like unemployment, homelessness, major health disparities. Actually, as far as health disparities, it is something that I've been dealing with and fighting against, I should say, for my entire time in public life. So it should come as no surprise, and certainly for many of us it did not, that Latinos were at a higher risk for physical, mental, and financial problems due to the COVID-19 pandemic. And Latinos in the Bronx they got COVID-19 at much higher rates than any other group. And they experienced the highest rates of COVID hospitalization and death. So we are that was the reality of the pandemic. And again, just to underline, this is just a way to say that there were things that were already baked into the system, sadly, that just made it worse, unfortunately, and tragically for so many Latinos and Latino families. So there's a reason for this. I mean, many Latinos work essential jobs like in grocery stores, transportation, healthcare, and manufacturing. Not only did they have an increased exposure to COVID-19, but during the height of the pandemic, these folks, they were still working. They were still getting in trains every day. Most of the people in my district get on a train every day, and we saw that there's actually, just to think about the national picture for a second, there are labor stats across the country that show that 13% of Latinos have jobs that allow for telework, right? So folks like myself, we had our offices set up in my house during the entire pandemic. But there are, in the reality is that only 13% of folks that are Latinos nationally have the ability to do that, while it's comparable to 27% for folks who are not. So they are less likely to have jobs that offer paid sick leave. There were greater risks of exposure to the virus, and they work in close areas or close quarters. And also, let's just be honest, right? There's also a cultural component here. There are multi-generational families, both for economic reasons and social reasons, right? The apartment that I have, by the way, which is a one-bedroom apartment, this is a true story. The folks who live above me, who live in the same type of apartment, I live by myself in a one bedroom. Upstairs, a family of five, two parents and three kids. And that's not rare, right? So when you take all of that together, we have all of these things meant that at the highest, at the point where the pandemic was at its worst, communities that already had disparities kind of baked in, it was going to be even worse, right? And there's conditions like diabetes, high blood pressure, asthma, et cetera. So there's a lot of stuff that actually has brought us to this point. So we're going to be doing for a little bit and you've heard me yap for a while, but I want to bring the discussion with two folks who are with us, who are going to be telling us a little bit, kind of talking through what are some of the ways that we can actually deal with this, to kind of realize where we are right now, and what we could learn from what has happened in the last year. So with us, we have Fabian Wander and Miss Hernandez, and so I wanted to welcome you both. And so we'll start with Dr. Wander. Doctor, correct? Dr. Wander?
No, I'm a clinical social worker.
Clinical social worker. And Dr. Hernandez, I want to make sure I get this right.
Miss Hernandez.
Miss
Social
Hernandez.
worker as well.
Well, thank you to both of you. But just let's talk a little bit about but Mr. Wander, tell us a little bit about how you, how is trauma? I mean, can you define trauma for us, right? Because this thing that we experienced in the last year certainly could be defined that way. So define trauma for us. How it's manifested. What are some of the symptoms, and how can it be unique in Latino communities? Kind of tell us a little bit about that as we think through what happened the last year.
Sure, and thank you for having me here, Senator Rivera, and thanks to St. Barnabas Hospital as well for hosting this really important conversation. Well, trauma is an emotional response to a terrible event. It could be an accident, it could be a death of a loved one, a rape, natural disaster, and immediately after that event, people experience shock, sometimes denial, are typical responses, and there are long-term reactions that include unpredictable emotions. So you might just kind of be sad in the middle of the day and not realize it, or start crying, or become very irritable. Some people experience flashbacks, maybe sounds from the traumatic event. Could be smells that they smell that trigger that flashback. It could be many different things that can kind of bring that thought to your mind. It can cause, strained relationships. Sometimes people experience somatic symptoms, physical symptoms like headache or nausea. And, I think thinking about like a traumatic experience that I have experienced about a year ago, my family, we had a fire in the house, and fortunately we all made it okay in the middle of COVID. But we ended up having to stay and rent an apartment, and our house was filled with smoke. And as we were leaving, the fire alarms went on as we're kind of exiting the home. And then maybe a month later, when we were at a rental, we were cooking something in the house, the fire alarm went on, and we all were triggered. We all kind of jumped, and it was just a beeping sound that triggered us. So we had that traumatic event, which was the fire, and the beeping, the noise kind of triggered us, and we all kind of froze. And that's kind of an example of what trauma is and how it manifests and how you can see it in different people.
So you would certainly agree with me that certainly, first of all, I'm glad that you and your family are safe. I'm hoping that you were able to move back into your apartment. But it obviously it is when you think about what happened over the last year, and there were so many, not only the deaths that we might have experienced in our families or our friends, but kind of seeing our communities kind of come to a halt, kind of hearing the constant ambulances. I mean, we're SBH right now, the ambulance is going back and forth. So certainly, based on what you're describing, obviously this situation that we all went through certainly we can say that it is a cause of trauma for an entire country, an entire world, and certainly that we can say that such a thing is going to have a large impact on communities that already had healthcare disparities kind of built in, so it was worse for them. Would that be correct to say?
Definitely correct to say. And to add to the trauma, there's something called vicarious trauma, and that's for like healthcare providers. Being that we're in a hospital, thinking about all those healthcare providers that were supporting COVID patients at the hospital, or family members, and really taking care of them, mental health professionals that were kind of hearing the trauma that people experiences. you start to create, you start to be impacted by that, and the term is vicarious trauma. So you're almost traumatized by hearing that experience, and you know have to be aware of those symptoms that you might be experiencing. COVID definitely had an impact on the entire community. The Bronx having these health disparities that you mentioned earlier, which included, led to higher death rates, higher hospitalizations. And so, there is a lot of fear in the Latino community about, the COVID, getting back to work, forcing people kind of to be out there. There are a lot of concerns and fears, and there's also a lot of misinformation out there.
Gotcha.
That isn't language appropriate, and then it kind of confuses people, and that I think is what I've been seeing currently in the Latino community.
Gotcha. So let's bring Mr. Hernandez into the conversation, and particularly based on your perspective as a child and adolescent provider. I mean, the context, right? I set the larger stage as far as what are some of the things that we had to deal with in the entire country, how it specifically dealt with the Latino community. Mr. Wander talked about what trauma is generally, and so let's actually drill down specifically as it relates to the perspective of your perspective as a child and adolescent provider. So tell us a little bit about in this context, what do you see particularly for young people, and how this has been, particularly traumatic for them? Like, what is your sense about where we are?
Right. I think, working with children and teens, I feel like the biggest challenge that I've been seeing is definitely the part where they've had to adjust to remote learning. Especially with Latino youth, they've had unique challenges with remote learning. A lot of them are first generation Americans. So parents aren't tech savvy, language barrier is a huge issue. Also, younger siblings are relying on their older siblings to help with online work. Also, now that kids are home doing their work, online, sometimes children even have added chores during their school breaks. And also, like you mentioned earlier, the factor of crowded multi-generational homes. It's really difficult for kids to work in that sort of environment. They're distracted, they're not focused, and they're not able to put out the same work that they would be able to put out like if they were in school in person. So that's what I've been seeing a lot. Kids are really having a hard time with remote learning.
And actually, let's go a little bit further into that, because I am thankful that we are hopefully, right, I'm crossing my fingers that we are near the end of this thing, at least some transition back to some level of normalcy. I would certainly argue that we cannot go back to normal, but that's a whole different conversation. We have to actually push forward in a different way, I would argue. But in any event, so as we get near the end of this, right, and there's many of us, I am House Moderna myself. I'm not sure about yourself, but I am House Moderna. There's House Moderna. There you go.
Sir.
And so, but as kids go back to a normal, to some level of normal, what do you think is going to be the consequences, right? The repercussions, if you will, of this whole new normal, so to speak, that they had to just get used to, now that there's going to be resumptions of schools in September, right? We just heard a couple of days ago from the mayor that there's going to be that it's going to go back to in-person learning, and maybe we should talk about like whether we should still leave some options open, for some virtual learning. But in any event, we're going to go back to that. What do you think is going to be some of the consequences or repercussions of that, of the last year in transitioning back to some level of normalcy in September?
Right. With some of the consequences of the social distancing for kids, I've seen a lot of kids who have been very reliant on social media, video games to connect with their friends. So I hear a lot of my kids telling me, oh, I don't want to go back. I got so used to staying home. And, they're just spending a lot of their portion of the days just with screen time. So that's one thing that I'm hearing come up a lot. And actually, some kids, I think around April, a lot of kids were going back to school for blended learning. And I've actually been seeing, for our program specifically, I've been seeing an increase in referrals since the children have been going back to school. And I believe a part of that does have to do with the difficulty that they're having adjusting back to this, what we call the new normal.
Mhm.
The kids, it's not the same anymore. Some kids can't sit in their lunchrooms anymore. They're wearing masks all day. All the fun subjects like recess, gym, art, music, they're much more limited now.
Yes, I'm
And
not sure how much you can play a trumpet if you have to have a mask on all the time.
exactly, yeah. So, and also, they're also confined to one room. They can't move from one room to the other to like they're used to. It's a lot less interactive. So they've been having a lot of trouble, adjusting back to that.
So, and I think we're all going to have a little bit of adjustment time. So I wanted to just, I mean, as we to kind of go down that road a little bit more, right? So we set the stage, right? I set the stage broadly, as I said earlier, Mr. Wander, for the entire country. Then talking about the Latino community, obviously, a lot of the folks that we serve, that live in my district, that you serve every day, are Latino as well. So, and Ms. Hernandez talked about the impact that it's likely that it's already having on children, and some of the challenges that we're going to have to face in the next couple of months as we transition back into normalcy. But as let's talk a little bit about where do you think specifically about the Latino community again that you serve every day, and more broadly speaking, as we go back to some normal. What do you think are some of the things that we're going to need to do to kind of like transition back? And if you have to just use your expertise, right, and kind of like make an educated guess here as far as what some of the challenges we're going to face, as some of the strategies that might help some individuals, because we all have to do this as well, right? I know that I'm having kind of a tricky time. As much as I might have been, it might have been weird to have an office at home. I had to travel here, so I had to think about the parking. I had to think about the driving. I had to think about all these things. But just talk us a little bit through about what do you think about some of the strategies that may help for adults as we come back to as we reach the end of this pandemic, and particularly as far as Latinos are concerned, what are some of the things that you think that needs to happen there, and some of the challenges we're going to face that are specific to Latino communities as we do that?
Sure. So first, I think it's really important to provide that support for the Latino community. And one of the things that we see is Latino communities have a high underutilization rate of mental health services, right?
Mm.
And so the Latino communities generally, when there is a mental health challenge, such as anxiety or depression, they see it as something physical or a spiritual problem versus the mental health problem, right? So this, will cause them to see a physician rather than see a social worker or a psychologist. So that is one of the challenges I think that mental health has experienced with engaging the Latino community. There's also changes in behaviors. Latinos are very kind of warm and they tend to hug each other and embrace each other when they see each other. And now it's like a different experience, right? And the cultural norms is something that we have to pay attention to. When people then, I guess, feel that comfort, if they have their vaccines, they can then do that again. But I think there's been a lot of kind of isolation amongst the community, especially the aging community, where a lot of family members feel they're fearful of interacting and getting their, let's say, elderly parents or grandparents sick with COVID. So they were isolated a lot, and that really caused, an increase of anxiety and depression amongst those particular people. So it comes with a lot of adjustments, and really looking at, okay, encouraging people to get the vaccine. Now that we're vaccinated, we can start doing some of the things that we used to do. Bringing that hope back to the community is extremely important. Basing a lot of information on facts so they understand what's happening. One of the challenges, of course, is language. When you're communicating to communities, if they're not really strong in the English language, they're not really fully understanding that messaging. So really communicating in the language appropriate information, engaging the Latino community in their particular settings. As a mental health professional myself, I change up the way I do my work. I actually do a lot of my work in the community. I do my work in parks. I do treatment in parks, walk and talk therapy. I think a lot of it has to do with meeting the person where they are And what I mean where they are is physically sometimes where they are, and not expecting them to kind of come into your office and come see you because they may not feel comfortable, whether going to a spiritual institution or, a park or another area where people tend to be. I think that approach is a lot more effective than expecting people to kind of come through your door saying, I'm really depressed, I need help.
And what would you say, Mr. Hernandez, particularly since you deal with a particular population, a younger population,
Right.
there's already a stigma, as Mr. Wander was saying, about mental health, period, right? And so in particular, when it comes to children who might not be able to make those decisions for themselves, right? There's the added stigma of the parents going like, I don't want to take my kid to, like, my kid's not crazy or whatever it is that might be there. Like, but what would you have to add to what Mr. Wander said?
I think, kind of circling back to what he said, it is definitely necessary to be as supportive as possible and take the time to have empathy for the Latino experience, right? And I think for parents, in order to help them, readjust back to what's coming in September and, and beyond that, I think it's helpful for parents to check in with their children, to try to reestablish routines. Very helpful. And, also we spend a lot of time in survival mode. We've been in our apartments. We're not doing the things that we're used to. So I am starting to encourage families to try to do their best to do things that they enjoy. Safely, of course, but, to try to get things back to normal.
Well, I would say one thing I would just to linger on for a second, and I want to see how both of you agree. Both of you agree, and we're coming into an end in a second. But I do believe that there's a lot of effort that we have to make as we think about all this transition that we're making back to some level of at least normal interactions or normal-ish interactions. I would argue that we need to actually ask real questions, whether it's, and I would say that for someone like myself, it is much broader. Like, we're talking about transportation, housing, criminal justice, et cetera, but certainly in health, we need to actually approach this differently. I think that what the last year demonstrated is that there's so many systems that are supposed to serve us that didn't. And we need to actually think through, use the experiences and the challenges that folks, that professionals like yourselves who help so many of us get through this, we need to think through how we actually transform these systems so that, God forbid we ever find ourselves in a situation like this again, that they actually work to serve us. But just in general, it was just a clear, sign of how badly they were built to begin with. So many of them, right? So Ms. Hernandez, would you agree with me that we need to use this opportunity to kind of reimagine the way that we do this? And whether you have any suggestions, whether it's for someone like a policymaker like myself, consider it lobbying, if you will, that you're about to do. But do you have any sense of what do you think we should be doing to reimagine how we do this?
Right. I think definitely access is the most important thing. Families really do, like, now we're doing mental health. So we're doing either video sessions or phone sessions. And I find that families really like this way. They like, they can have sessions from the comfort of their home. They don't have to travel. Some people don't have money to travel to the office, or they're still have anxiety about going outside because, the pandemic is still going on. So I think just continuing this telemental health is really good. It's been working very well for my patients at least, and I think it'll work for most people too.
See, funny enough, Mr. Hernandez, that you kind of hit the nail on the head on that one. There's actually some proposals to actually keep some of the changes that happened in telehealth that were done because of need during the pandemic. There's actually some proposals that I carry to change the way that we actually use telehealth and reimburse telehealth permanently, precisely because of what you said. It actually, a lot of it was, by need, right? It was like making lemonade out of lemons. But we found that in certain cases, it actually is helpful to expand access to certain populations that might, as we transition back to some level of normalcy, might not have the same access if we take it away. So you you're ahead of the curve on that one, and I applaud you. We're looking to push for that in the state of New York. I'm gonna work on that.
Excellent.
And I think that we have a pretty good chance of actually passing this series of bills that deal with that. Mr. Wanda, do you agree? Do you have anything else to add?
Yeah.
As things that we need to do to transform?
Thank you, Ms. Hernandez. I'm going to build on what you said, but also what you mentioned. You know, there's a lot of inequities in healthcare in the Bronx and in the communities of color, and you see that a lot, right? A lot of that came out in COVID, where you see kind of how some people were getting healthcare, some people were not getting the same type of healthcare, all that access. You know, there is systemic racism that is embedded into a lot of these systems, and really, the systems were designed for people who live in poverty or the different types of challenges that many communities that we work in face. So it's really a good opportunity now to look at those systems and say, how can we make it work better? How can we engage the communities that are underserved? What are they missing that other communities have? How do we kind of fix that inequity that we see in the healthcare system, whether it be medical health or mental health? So that's definitely important. I think, you know, your point, Ms. Hernandez, to the Wi-Fi, I do a lot of telehealth, and you know, there are people who do not have stable internet services, that don't have the capacity. I work in a college with college students that, you know, we're trying to link or find Wi-Fi hotspots that they can connect to, so they can do their work, their schoolwork. So it is a challenge. And it's really a very good example of how these inequities exist, where someone can just turn on a laptop and get their work done, while someone has to struggle or share a laptop with their 3 or 4 kids and their partner, and take turns. And you see, it's like, well, you're trying to get the same assignment done, or the same project completed, but now you have to wait for everyone else to kind of finish using that laptop. So I'm really happy, Senator Rivera, that you're pushing this and you're bringing that to the light, because it's super important. And really, what we've done, putting those, you know, Band-Aids on, creating that lemonade, I think it's something that we need to see
You mixed
what has
Band-Aids
worked.
and lemonades. I'm not so sure that I
Well, you
wouldn't
know,
necessarily do that,
we
but
we
okay.
we put a Band-Aid on
On a
the wound,
lemon? What's
but
happening?
no, we're gonna bring it all together. We put
Okay.
the Band-Aid on that cut. We didn't really solve the problem, right? You
Yes.
did make lemon out of lemonade by providing these programs, and there's access, but it's a lot bigger than that, and we have to understand how to invest into these resources and create these equities, especially when it comes to technology. I think that's really important.
So doubling down on on providing telehealth, as Ms. Hernandez said, and also, and I agree with you completely, not ignoring the lessons that we were taught. Well, I should say the lessons that some people were taught, because there's many of us, and I would probably include both of you, who kind of, because we do work in these communities all the time, we knew that these inequities existed. We saw them during normal times when, you know, when we could still go to concerts and, you know, outdoor, you know, indoor events, etc. The inequities were still there. So you're saying not to ignore what we have been taught by the pandemic, and make sure that as we're developing policy, whether it's in telehealth or expanding access to technology, et cetera, that we take that seriously, and that we lean into actually solving what the pandemic has shown us so clearly. Like, and I would agree with both of you. Not so sure I agree with like pouring the lemon juice in, like in the thing with the cut.
Yeah,
That
don't put the
I would,
lemonade
I
on the
need
cut.
to work on that analogy, bro. But that's fine. That's fine. I get what you're saying. But in all seriousness, I want to thank Mr. Wander and Ms. Hernandez. Again, both very important parts. These are the kind of folks that do work here every day. You know, in the case of Mr. Fabian Wander, clinical social worker here, and Ms. Shalina Hernandez, licensed master social worker at SBH Health System. Both of them do work every single day to serve the folks here in the Bronx, in this great institution. I thank you both for being part of this conversation today, and I thank SBH for inviting me to guest host. To our listeners, I thank you for joining me today on SBH Bronx Health Talk. And for more information on services available at the SBH Health System, visit www.sbhny.org. That is St. Barnabas Health Network, or Health New York, SBHNY.org. newyork.org. So thank you so much for joining us. Thank you, Mr.
Thank you.
Thank you.